As everybody is going to kind of gradually join into the webinar, we're just going to wait a few minutes as people start to join in with us. Good evening. Thank you so much for sharing your time with us tonight. My name is Christine Yelding, and I am the SEL and Systems Administrator for Forest Hills Public Schools. Much of my work is spent working directly with counselors and our mental health liaisons on systems that support students and families. I am also the district liaison to our co-host for this event tonight, our parent group AAA, which stands for Awareness, Acceptance, and Advocacy of Mental Health. Tonight's panel is our first of our parent series this school year. The goal of the series is to provide both information and resources to our community. At the end of tonight, we will share details of our next event in February. This evening, our panel is comprised of both Forest Hills employees and community members who have expertise and experience with some of the physical and psychological triggers that impact school attendance and engagement. With us tonight, we have Dr. Kathy Howard, who is a board-certified pediatrician, fellow of the American Academy of Pediatrics, and medical director for two nonprofit organizations, Fit Kids 360 and Health Net West of West Michigan. Also joining us, we have Dr. Kyle Ahonen, who is a board-certified adult psychiatrist, fellow of child and adolescent psychiatry, and currently practices at Pine Rest Christian Mental Health Services. In addition, on our panel, we have Mr. Mark Larson, attendance officer for Kent County, Christy Sherrington, Pine Ridge and Northern Trails counselor, Becky Telzero, Northern Hills Middle School counselor, Maddie DeBoe, mental health liaison for the district, Tamara Laghi, AAA member, and Michelle Cox, AAA member. The format of tonight is mostly our keynote panelists sharing information about what school avoidance looks like and helpful strategies and resources for families who may be struggling to get their child to school or keep them there for the entire day. At any point during the webinar, please feel free to add questions or comments in the Q&A function located at the bottom of your screen. We will be monitoring these throughout. Panelists will respond directly, or we will pose the question to the group for feedback during our Q&A portion at the end. To start us off this evening, Mrs. Maddie DeBoe is going to share some student profiles with us that we sometimes see in the school setting in regards to school avoidance and refusal.
Hello, everyone. Thank you for attending with us this evening. As Christine stated, my name is Maddie DeBoe, and I am one of the mental health liaisons with Forest Hills Public Schools. As part of my role, I get to work closely with the student counselors, as well as students and their families in a variety of situations. I'm very excited about all the information that we will learn from our speakers and panelists this evening. I wanted to take a few minutes just to talk about what we do see at Forest Hills in the area of school avoidance. It is important to note that we see a significant amount of students who deal with school avoidance, and it's often for a large variety of reasons, and many of those you will hear more about later. At the elementary level, it is very common for students to not have the insight or the language to really articulate why they may not want to be at school, but they often show us with their behaviors what they are feeling on the inside. In K through 4 specifically, students may have a hard time at drop-off when it's time to leave their caregivers and enter the building. I've worked with many families, however, that once we can get the student inside, they are able to have a successful day with the support that the school is able to offer. Throughout the day, teachers at this level may notice that students who are school avoidant might complain of stomach aches, headaches, spending a lot of time in the office or just outside of the classroom, and requesting to call home multiple times a day or multiple days in a row. As students get a little older, we may see that they can articulate a little better the why behind not wanting to be at school, but this can still be difficult. As they enter middle school, we have a lot of students that become overwhelmed by the changes in classes, the increase in academic requirements, and staying organized with some of the new things that they have to experience at this level. There also becomes an increased awareness of their peers. And when there is conflict with peers, this can be a big deterrent to getting to school and staying there. Other things that I hear a lot of at this age is that they start to worry or doubt their academic performance or acceptance from their peers. We also know that students are having conflict with peers that can be a big influence in their willingness to attend. The behaviors we see might tell us more than they actually do. And so it's important to take the time to try to talk to them and see if they can articulate, again, the why behind wanting to stay home or not being in class. With the information provided tonight, I'm hopeful that parents will feel more confident in their decisions to consistently require school attendance, even when it is difficult. It is also important for parents to know how to partner with staff at each school building. And with that, I will hand it back over to Christine to introduce our first speaker.
Thank you, Maddie. Some of those examples might be the reason that you are here tonight, and we truly appreciate that. Dr. Howard, I'm now going to turn it over to you to start us off with some of the physical signs we can see in school avoidance.
Thank you. Good evening, everyone. I'm Kathy Howard. I'm a pediatrician at Forest Hills Pediatrics. And what I've been asked to discuss is, what does school avoidance look like? The definition of school avoidance is a child-motivated refusal to attend school or refusal to remain in school for the entire day. So what might your child be telling you? Many of these children already have anxiety-related symptoms at home. So for many parents, this does not come as a complete surprise. Typically, symptoms are going to occur almost exclusively on school days. And oftentimes they have a gradual onset where at first they may only be asking to stay home a few times, and it escalates over time to several days a month, several days a week, and then perhaps several days in a row. It often will seem much worse after weekends, after extended school breaks and holidays. The symptoms are much worse at school than at home, and they escalate as school becomes closer and closer. So after a long break, it might be a few days beforehand where they start to talk about it. And then as the return to school gets closer, their emotional reactivity gets worse and worse. These children will almost always show significant emotional distress as the topic of school gets brought up and the approaching school day gets closer. They are often very fearful. Many of the younger children will display tantrums and crying, and sometimes the older children will even threaten self-harm if they are asked to attend school. What type of anxiety might be causing this? A little bit of this was mentioned already, but some of these children really fear poor performance at school and feeling like a failure. Sometimes kids who have significant learning disabilities really feel like they're struggling so much that they don't want to go to school and not perform well. Sometimes there are problems with other children, like teasing, bullying, or the fact that they don't feel like they have many friends. Oftentimes kids with anxiety will have great fear of using public restrooms. And for some children, that is enough to not want to attend school. Some children are showing significant separation anxiety from their parents, not only around school, but in other circumstances, but it can make attending school very challenging sometimes. Some children seem to think that perhaps their teacher doesn't like them. They may not really enjoy the personality or teaching style. And for some really sensitive children or kids with severe anxiety, there may be some styles that really cause them great distress. And then sometimes when bullying is going on, there are either threats of harm or the actual occurrence of harm that is occurring to the children that make them not want to attend school. And they may not be sharing that information with people. So how can you tell if your child is truly sick? It may not always be easy in the beginning, but I think once we see a pattern of behaviors, parents should start to question whether the physical symptoms are really true. So are there verifiable symptoms? Is there a fever? Is there protracted vomiting? Is there obvious uncontrolled or recurrent diarrhea? Do they have a severe cough? Have they been losing weight? Are they not able to participate in what you would consider daily functions at home? Are these symptoms persisting? Do they occur on weekends, evenings, and vacations? Is there emotional distress or not? And are they threatening, panicking, and having tantrums? So I think overall, for the most part, once this becomes a recurrent problem, it should be pretty clear to parents that these symptoms are more than just physical. What kind of complaints might your child say? These are probably the most common ones that we hear. Things that also really can't be verified physically. So they might say that they're dizzy. They might complain of being very sweaty. Chronic headaches are a very, very common problem that we see in both kids with school avoidance and children in general. Sometimes they will get very trembly and shake when you start to talk about them having to attend school for the day. Maybe they'll complain of their heart racing or being irregular. They might say that their chest hurts. They may complain of abdominal pain. Nausea and vomiting are also not uncommon. Some kids with just the thought of attending school might run to the bathroom and throw up. Sometimes when they're getting very nervous, they may have diarrhea. And then there are just the sort of general complaints of aches and pains like back pain and joint pain. So when do you need a medical assessment? If we have symptoms that are persisting for more than a few weeks, I would suggest calling your pediatrician or family doctor. If the symptoms seem very severe, I think you need to call. If you feel that your child is exhibiting a lot of emotional distress, that's also something that we need to be aware of and perhaps do an assessment for. If you find that their school absences are increasing, if you're at all suspicious that there's a presence of anxiety or depression, if you find that the symptoms and school absence are causing distress for your family, and oftentimes we will get the phone calls when the parents literally cannot get their child out the door or out of the car, that's when we'll get a phone call saying, I don't know what to do anymore. Some of these kids, if you're really suspicious they have a learning disorder, then we should be involved. If you have any fear that they are being threatened or harmed at school, if you find that your child is having significant social problems, so they're not able to make friends, they want to avoid all social situations, or if they're having significant separation anxiety, those are all reasons that we need to do an assessment. And if you find that they're unable to participate in daily activities, it's probably more than just school avoidance. That's something that we need to help you figure out. So really what it comes down to is any child who we suspect is having school avoidance probably needs a medical evaluation just to make sure that the chronic complaints that they have are not physical, and that we perhaps need to help partner with the school and the parents in a plan to get them back to school. And that's something we do quite commonly.
Thank you, Dr. Howard. I'm now going to ask Dr. Ahonen to share some of the psychological components when it comes to school refusal and disengagement.
Wonderful, thank you. Let's get this started. All right. Okay, thank you so much for having me tonight. This is such an important topic, as is the mental health of children and adolescents in general. I am a board certified adult psychiatrist and in my second year of child and adolescent fellowship at Pine Rest with the Michigan State University Residency and Fellowships program there. No relevant disclosures. This is our outline for the brief talk tonight. Some reasons for school absences, just kind of in general. Some risk factors, triggers for students, general treatments and interventions, and then I'll conclude just to make a highlight of some of the big points. Okay, so being a psychiatrist, I'm going to focus on the mental health issues, and I put some bullying and educational difficulties because that commonly falls under the domain of a lot of the kiddos that I see. Thanks, Dr. Howard, for the wonderful presentation before this. He covered so much. I won't have to cover quite as much. And then some other reasons for school absences include family or community neighborhood issues and chronic absenteeism, which in the past and in some literature and textbooks still referred to as truancy, but that might stigmatize the population. So we don't use that term as much anymore. So in terms of mental health issues like anxiety, like what is anxiety? Anxiety is worries, fears, encompasses a number of physical symptoms as well, including palpitations, hyperventilations, nausea, headaches, stomach aches. In general, there's a couple, multiple different types. If you want to get specific, but in general, it's kind of specific anxieties and general anxieties. Like specific anxieties could be phobias, could be like fears of certain aspects of the school environment, whereas general anxieties may be triggered by a variety of things, not just one thing in particular, and generalized kind of worries, fears of bad things happening to themselves or family members. And then we'll cover kind of some potential anxiety disorders, like when does it become a disorder? When do you need like a mental health evaluation? When should you be kind of more concerned about your kiddo? And then what's typical for some school refusal anxiety? Anxiety in the mornings, typically physical symptoms that resolve by midday, and include headaches, stomach aches, hyperventilation, those sorts of things. So what are some anxiety disorders that might potentially underlie kind of school avoidance or refusal? These could include like separation anxiety disorder, which commonly develops in kind of younger children, usually remits at some point through elementary school. Panic disorder usually develops kind of pre-teenage, teenage years. The panic disorder is differentiated from panic attacks by the fact that panic disorder kind of involves such an extreme fear of having panic attacks that these kiddos will avoid like any potential situation that might trigger a panic attack. Specific school phobias, kind of in the name, kind of avoiding school for one reason or another. Social phobia or social anxiety disorder is also another common one that we see. It develops in like the preteen years, fears of embarrassment or humiliation in front of their peers. Could be related to some aspect of performance anxiety as well, involving presentations or exams or other group projects, maybe group work or teamwork or performance when they have struggles with dyslexia or dysgraphia or other learning disorders, potentially bullying as well. Agoraphobia. Agoraphobia tends to be such an extreme fear of leaving their home, staying at home for kind of weeks or months at a time without leaving. That's when it would become kind of problematic. Adjustment disorders is a reaction to an acute stressor, usually fairly mild, but can result in some impairment if it's associated with anxiety problems, depressive, symptoms or problems, or changes in their kind of behavior or conduct. What's typical for school refusal anxiety? We've touched on this already. I won't go over it too much more, but mornings, physical symptoms, including headaches, nausea, stomach aches, kind of sudden complaints arising in the morning that typically resolve around midday, might persist for a couple of days or be worse, as Dr. Howard said, after breaks or snow days, such as last week. A lot of kids I see struggle with that coming back to school, even if they had a good routine or good momentum for school attendance kind of before that. Disruptions in kind of daily life can throw that off. Some examples of school stressors include this performance type anxiety or test anxiety, bullying, looking for bullying in school-age children is also really important. Puts them at risk for other issues as well. Educational difficulties, school personnel are really good at identifying. I think if students have learning issues, but if you have questions or concerns about reading, writing, or math, please also do reach out. It's really important to identify learning issues, learning disorders as early as possible so that interventions can be kind of developed, planned, and implemented so that your child or adolescent can do their best. Neurodevelopmental disorders such as autism spectrum disorder, attention deficit hyperactivity disorder, if you have questions about these, there are examinations that pediatricians or psychiatrists or school personnel can do to screen for these conditions. In terms of other mental health issues, depressive conditions and depressive disorders are another kind of potential cause of school avoidance. So I did want to touch on depressive conditions. One way to, in general, to recognize, is my kid depressed? I tell parents, a change in your child or adolescent's behavior, a change from their normal, maybe being more withdrawn. Common in kids is being more irritable, kind of having behavior issues as well, engaging in different activities or no activities at all, withdrawing from their friends, having more negative self-talk and more defiance. If you're concerned, the best way to find out about it is to ask directly. You can reach out to their friends, reach out to their teachers, ask school personnel. Kind of in any mental health presentation that I do, I always love to, touch on suicide because it's such an important topic for children and adolescents. Some of these coming slides are adapted from a presentation I did last year with a couple of my wonderful colleagues, Dr. Edwards and Dr. Rawlings, for community partners with Pine Rest. So the importance of suicide, I don't have to harp on this too much. I'm sure you're aware. Nearly 1 in 5 adolescent deaths is due to suicide, unfortunately, after accidental injuries. It is the second leading cause of death for individuals 10 to 34 years old. And kind of as we've seen with the pandemic and the lockdowns, with higher frequency of depressive conditions and issues and social isolation and increased suicide attempts and hospitalizations, we know obviously this is an important topic. So some common misconceptions about screening for suicide include, I heard about asking about it puts the idea into their heads. Research actually shows that it doesn't, and this is pretty strong research showing that it doesn't. And then people wonder, well, I'm maybe a parent, maybe I'm a friend, a coach, a teacher. I don't know how to do this. Like, isn't this for professionals? Doesn't actually require specialized training. I'm going to go into it in just a second, but it's fairly straightforward. Common tips I give people is just asking directly about it, even though it's uncomfortable. You're not going to put the idea into their head. There are tools available to guide you in asking these questions. And just to give you kind of an idea, I mentioned the second leading cause of death, but kind of 50% of all mental health conditions or disorders develop by the time someone's 14 years old, and 75% by the time they're 24. If someone develops a major depressive disorder, let's say around 10 years old, suicidal thoughts usually lag behind the development of depressive disorder by about 12 or 18 months, maybe 2 years. And so first identifying the depressive condition is really important, and also screening for suicide. Because after the development of suicide, ideation or suicidal thoughts, usually the first suicide attempt comes later. And so early identification and intervention and screening is really important. Here's an example of a screener that parents can download online from the Columbia Lighthouse Project. And this is one that I've given to parents in the past just to guide them through it. I don't know what to ask. What do I do if they say yes to one of these questions? This one has yellow, orange, and red categories to tell you what to do. It's also got the suicide prevention lifeline down there on the bottom, and it tells you what to do if they answer yes to any of these questions. And And you might never know what your kids are thinking or what your students are thinking unless you ask. Now I want to touch on some other factors that might lead to school absences, and these include family or community or neighborhood issues. There are many, such as chronic illnesses in a parent, substance use within the home, neighborhood violence. The number of adverse childhood experiences is related to absenteeism and risk for dropouts. Housing instability, unreliable transportation, family responsibilities, conflict within the family unit, inconsistent parenting, maybe going from one home to the other, engaging in illegal activities or involvement in the juvenile justice system. If you have to go to court, if you're ever in juvenile detention, you're going to be missing multiple days or weeks just because of the fact of being removed from your home environment. And then you could thus fall behind on learning and development. Now, what's some treatment for school avoidance? What can we do about this problem? First, we can identify it, and then we can just all cooperate and work together to help these kids, families, clinicians, school professionals, provide education to parents. Parents aren't aware of what to do or what to look for or how to approach this issue. It's hard to know what to do. Identifying root causes of behaviors, tailoring treatment to those root causes, identifying underlying emotional, mental disorders, treating those appropriately, getting kids the help they need, helping to destigmatize mental health conditions, planning, facilitating early graded return to school at a pace tolerable for the child. This is so important. Sometimes, telling the kid, yep, gotta go. If kid's been gone for multiple days or weeks, getting back to school may be hard, but if you can get them back to school for at least part of the day, that can help so the way anxiety works, kind of in general, is it's kind of like this thing that if you feed it, it gets stronger. Like if you avoid something because the anxiety is telling you to avoid it, you're going to be feeding that anxiety monster. And the more you feed the anxiety monster, the bigger and stronger it gets. So to start taking power back from that anxiety monster, you got to talk back to it. You got to say, no, I am going to go to school. I am going to do this. I'm not going to avoid kind of this thing that is making me anxious. So even doing little bits at a time can help make that anxiety monster weaker and make you help you take more power back from it. Sometimes, we have to definitely emphasize helping parents make it more rewarding for their child to return to school than staying at home. Of course, at school, in the school environment, identifying, addressing bullying or educational difficulties if present, helping to utilize maybe even other students in the classroom to kind of talk back to bullies, not be a bystander, but to be like an upstander. Treating parental mental health conditions is also really important. Parental history of anxiety, depression, interpersonal conflict, and other issues can cause stress within the home environment, make it more prone for kids to develop anxiety or school avoidance. Certain types of psychiatric treatment that I commonly recommend for anxiety and mood disorders. Now, question, when does something become a disorder? It really becomes a disorder when there's significant functional impairment. Dr. Howard mentioned some of those factors or some of those things kind of earlier, but essentially think about something going on for multiple weeks, maybe even months, causing significant impairment, AB student going to failing grades, withdrawing from friends' activities, engaging in self-harm, problematic behaviors for multiple days, weeks, something persistent, not just kind of a one-off or just like a occasional here and there sort of thing. Certain types of therapy are very effective for anxiety, especially mild to moderate cases, kind of by itself. Cognitive behavior therapy, interpersonal therapy, family therapy, lots of education, cognitive restructuring, addressing negative self-talk, doing education like what I just did about the anxiety monster, helping to take power back from it. Medications can especially be helpful for more moderate to severe kind of anxiety and depressive disorders. We do know kids get better faster and stay better longer, just like adults, kind of when we do both. And there's evidence for medications and therapy in a variety of conditions, including ADHD, major depressive disorder, and other anxiety disorders. Now, just kind of recapping On the important points, there are multiple risk factors, triggers, and causes of school avoidance, refusal, and absenteeism. Anxiety is a really common cause of school avoidance and refusal, and we talked about how to identify that. Family, school, and clinician engagement are important to get kids back in school and to keep them there. Planning, facilitating graded return to school is sometimes the appropriate choice for a child. And then treatment for parental and child psychiatric conditions if present, specifically therapy for mild to moderate cases and therapy plus medication for those cases that are moderate to severe. And then here are my references, and thank you for allowing me to speak tonight. I'm really grateful to provide education and meet with parents and other colleagues interested in this topic.
Thank you so much, Dr. Ahonen. Mr. Larson, we have one question for you. When a student is identified as chronically absent, and you can explain maybe what that means as well, can you share what the purpose of an attendance plan is that comes out of your office?
Well, the attendance improvement plan, the format comes out of our office, but it's written in conjunction of the school, the parent, and the student. And it's the heart of the attendance correction process. It's a time for those parties to sit down and identify the problems and barriers, identify the strategies and the measurements, because accurate, identifiable, quantifiable goals are really important. So to identify those goals and then set up a feedback schedule. This is not designed to be something we write and check off a box that we did this step. It's really designed to be the heart of the correction process, including all necessary professionals, outlining those things I mentioned, barriers, strategies, measurements, identifiable, quantifiable goals, and the feedback schedule to work toward those goals. And it has some other layers and some other purposes. There is a legal requirement as soon as chronic absenteeism is identified to partner the attendance officer and the school, and then to have a meeting between the school, the student, and the parents, as I mentioned. That is a legal requirement, but why meet if we're not making that an effective tool? So that's when we engage the attendance improvement plan.
Thank you. And truly trying to partnership with all entities so that everybody feels connected and we start taking those steps in the right direction. We are now to the Q&A portion of the evening. Panelists, if the question is geared towards one of you specifically, we may ask you directly, but if you have other feedback to add to questions, please feel free to do so. Are you guys able to hear Michelle's questions? No. Okay. So I will, thank you. That's great feedback. All right. So Christy, I'm going to have you answer this one. So the question is, if I had a hard morning with my son, but I finally get him to go, is there anyone there that could actually check on him to see how his day is going?
Yeah, thanks for asking that, Christine. We see that often in the elementary setting, and the short answer is yes. We understand as school professionals that it is stressful for parents to try to battle it out, getting their child out of the car and into the building, and then go on to have a normal day at work. And oftentimes parents will say, hey, they'll reach out to us. How is he or she doing? Oftentimes we just take that upon ourselves because we know that's stressful for parents to, after they get into their day, if it's going well, if the child is stabilized, we'll reach out to the parent as soon as we can, say, hey, just wanted to let you know, just to reassure you, he or she is doing better. They're engaged. They seem to be having a good time in the classroom. Maybe this is a point when they get home to have that conversation of, hey, buddy, way to go. You did a great job today. A lot of praise, affirmation on the part of the parent upon coming home. I knew you could do it, empower them, build their self-confidence. And, even maybe as some sort of tangible reward if that's appropriate in that instance. So also we do have people that, have relationships with the kids. Like, relationships are huge when it comes to building community in a school and helping children to feel safe and connected to their environment. So if there's an adult that's has a particular connection to a student in that building, we want to identify who that adult is so that during the school day, whether it's myself or the principal, we can continue to monitor the situation. If the instance goes south and that the child is not improving during the school day, we will continue to reach out to the parent, let them know kind of what's happening with their child, and partner with the parent to see, what's the plan going forward? Are we going to try to keep that child at school, which is of course our goal as much as possible? Is there a point where the child is emoting so much that they're just flat out exhausted in the health room and they're falling asleep, for example? In those instances, then we reevaluate, okay, is it possible to get that child back, or is it better in that instance for the child to go home? But in either instance, we are monitoring the situation throughout the day. And if it becomes a chronic thing, then we set up a plan like Mark indicated.
Thank you so much. Okay, so we got one from the audience right now. Can an IEP help if you have an anxiety diagnosis or disorder? And what might the plan suggest to help the student succeed?
Well, I'll take that one. So if I understand the question, if there is an IEP, which is an individual educational program, it's a special ed umbrella service, legal service. If a student has been diagnosed with an anxiety disorder, are there services? Is that what the question is, Christy? Okay.
I think more so like, what are the things that are used in the IEP to provide services that would help with, I would imagine, related to maybe attending school or
absolutely. Yeah, absolutely. That is determined by the team approach. The parents are involved, family members are involved, critical counselors and social workers. There's a whole team, psychologists, a whole team that is put together to determine what are the appropriate goals and how are they going to meet those goals. So it's a very individual answer, but there's lots of scaffolding to help support that student as well as the family. Very similar to what Christy said, but just in a more formal, written, systematic approach. It could be a modified schedule, a shortened day schedule. There could be small kind of approximation, get the students into the building. As Dr. Ahonen had mentioned, as one of the therapies and treatments. It could be collaboration with outside therapists as well. That's one thing that we work really hard as school counselors, is to build a bridge between community counselors and therapy so that we can augment the treatment and not contaminate it. Trying to find that balance of scaffolding up a student and empowering them with real life skills while addressing the initial concerns that student and family has.
Thank you. All right, Dr. Ahonen, this one is for you. Could you elaborate on the point, help parents make it more rewarding for children to return to school than to stay home? Do you have any advice on this? My son is 12 and in 7th grade.
It's a great question. So it's of course going to be individualized for your kid. You're going to know what they like. We want to avoid punishments. Punishments don't work. It can be hard to come up with positive or even, harder to come up with negative reinforcements. A positive reinforcement is giving something that the child or adolescent likes, something that they want. A negative reinforcement would be kind of taking away something that they don't like. Like a classic example of a negative reinforcement is like if you're out in the rain and you put up an umbrella, it's going to keep you dry. And so that's a negative reinforcement to continue using the umbrella. So if you can think of specific things that your son or daughter may like or may help motivate them to getting back into school, because school is one thing that's going to help set them up for success in the future. And for a 12-year-old, thinking about the future may not be as big of a motivator as someone who's maybe 17. And so kind of individualizing that for your kid. It's hard for me to do from a distance, but you might be able to come up with some things just knowing him.
Thanks.
Could I add to that, Christine?
Yeah, absolutely.
What a great gift it is to have 12-year-old boys in our building, that is for sure. And to try to find out what really makes them tick. And the partnership with families is just outstanding as well. So we can brainstorm really, again, some real individual ways of meeting that student's needs. Because we're not looking at trying to change the personality or the interest of a student. We're trying to work cooperatively with the student. So one of the just very simple things that we can do at the middle school level is to change their schedule. And maybe this is a real creative student. So we might look for the first hour of that student's day be with the art teacher so that they can build that relationship and solidify a great connection. So there's another healthy adult in that student's life that that student knows that we have their back, not just the office, but people out in the hallways for them. Or maybe it's the opposite. Maybe it's a real athletic kid and they want to start their day with PE. Well, maybe once they get here and we can slowly approximate them into the building, maybe the PE teacher takes them down for open gym and they play an activity to have an incentive, a positive reinforcement to get into the building before the day starts and before those scary thoughts can take over. It might be providing a student a quiet place for lunch. Maybe it's too noisy at lunch. So let's find a nice quiet place and maybe a handful of their special friends to build that structure for them. It could be snacks. I love to work for snacks. So maybe third hour, they're hungry. Well, let's make sure that we have their special, their special snacks. And we make sure that the teacher is really okay with what's going on in the classroom. At Northern Middle, snacks are always available for all of us, which is awesome. So we are constantly taking a look at having that student lead us what is a positive incentive for them. Because sometimes as an adult, even if we're seasoned for 25 or 30 years, sometimes we get in the way of what kids really, really want. It may not be this big, huge, another hour of gaming. It might be, Culver's Happy Meal or something. It could be something so much smaller than we really think, or like I said, it could be just a different art class. So we really work hard at listening to the student and giving that student voice so that we can make changes to augment their learning and their environment versus trying to push them into our structure.
Thanks, guys. All right, next question. Do you have any recommendations for someone who is working with teenagers who have depression and refuse to go to school?
I'm reading this question as they're asking about outside support as in working with. So if that is part of the question, the answer is yes, but there are many and it can at times be really hard to navigate. So that is why the district does have mental health liaisons to try and help families with that process. So every attendance area has one. You can talk to your school counselor, the principal, and they can point you in the right direction. So there's not really I could rattle off some names, but it would probably be a better use of everyone's time if the parent wanted to reach out to their liaison to get specific recommendations on who in the community does work with teenagers with depression who have some school refusal. But if they're talking specifically inside the building, then maybe someone else can address that piece.
So I'm going to go to the next question. I do think it was outside resources. Next piece is when there has been chronic absenteeism and we are just realizing that is due to severe anxiety. Should we start an IEP or a 504 plan?
I can speak to this one, Christine. So oftentimes both are an evaluation to determine what accommodations we need to help level the playing field for a child so that they're more successful in the academic setting. So when we're looking at a 504, it's more for a general education student versus IEP for a special education student. So in our district, counselors are in charge of doing evaluations for 504s. So really a lot of it will come down to does the parent have an outside evaluation, psych eval? Has there been a diagnosis? Has there not? That will change how we do things. If there has been a psych report and we've gotten it from an outside eval and we have that to work from, there's usually lots of The psychologist provides a lot of summary of interventions that we can use, accommodations that we can use to problem solve in school. But oftentimes we'll start with a 504 and see if those general accommodations will help level the playing field, help that child to have the accommodations they need to be successful. Oftentimes, if that doesn't work, is not successful, then we go on to look at a possible IEP and if they qualify for those services. So hopefully that's helpful.
Thanks. Okay, so I'm going to, oops, sorry, I just lost my screen. Oh, the next question was, what does the team look like at the school level? So like, what would it, if I'm struggling with this as a parent, who is my team? Who are my contact people at the building level?
Again, I would just say, like, if you're wanting a 504, for example, you need to put that, contact the counselor to get that going. But the team usually includes the school psychologist, the school social worker, the principal, sometimes other itinerants that work in the special field, maybe the speech pathologist, or the like I said, the counselor. Those are the people that really try to come do the wraparound approach and really look at the whole child and look at the academic piece. How are they performing socially? Do they have friends? All of those things. And we, of course, we partner with the parents during the entire process to partner with them, because you know your child the best, in coming up with creative solutions to solve the problem. So that would be the team that you would contact. But I would say the first go-to would probably be your child's teacher at the elementary level, or maybe at the secondary level. And please chime in if I'm wrong, but probably the counselor or the principal.
No, I agree with that. That's great, Christy. I would also say too that the parents know their kids the best, and we take their lead. We take parents' lead. Like, they may not want the grand team approach that Christy just said. Maybe they just want the counselor, the head secretary, and the front desk secretary know. So we don't want to share a narrative or share a story that student's not comfortable with the world knowing, or all 7 teachers knowing. But maybe they're really big readers, and maybe they want that media center specialist to know, so that media center specialist can provide a nice, quiet, comfy spot for them when they come in the door, and that could be their spot or their person at lunchtime. So we really ask that, the family members, who do you want to know? Who do your children feel? Who does your child feel will have their back, so that we can provide those additional supports? Again, healthy adults, healthy peers in their kids' lives.
All right, the next one is for you, Becky, too. So
Okay.
what incentives could the school provide to help me motivate my daughter to go?
Yeah. Again, kind of like what I said a few minutes ago, let's have a conversation with their daughter. What is it that might be causing the discomfort, and what do they feel they need to overcome that? One of the tough conversations we have sometimes with students is that our role as counselors is not to remove the anxiety, because anxiety is everywhere, from here till when you're 60. It's part of being in the human condition. But what we want to do is work with them to get them some really good workable tools and skills that they can employ when those monsters start to creep into their heads, so they can give themselves faster positive self-talk. But again, it could be greeting the car when mom comes and drops them off. It could be having a hot chocolate ready for them, in my office. It could be that modified schedule with maybe 1 or 2 of their special buds that they know they have their back. A quiet space for lunch, or maybe active space during lunch. It could be, depending upon the severity, if it's moderate to severe anxiety or depression, it could be a modified schedule. It could be just core classes and not extra classes. It could be electives first in their day or electives in the end of their day. It's very fluid. It's all about what can we do to meet that student's need in conjunction with the therapy.
I'd like to throw in that it's also really important to understand that anxiety oftentimes is a proximate cause, but not an ultimate cause. By that, I mean, it's real. Let's not try to dismiss it, and it has to be addressed. But oftentimes we're learning that the anxiety comes from a history of chronic absenteeism. Chronic absenteeism, defined as absenteeism as 10% or more of the school days measured to date, is not benign. We're finding that 1 year of chronic absenteeism in K-3 is highly predictive of school refusal, either in the first year of middle school or the freshman year of high school. We're also finding with good Kent County data that every year of chronic absenteeism reduces the likelihood of retention to graduation by almost 10%. So that's pretty sobering. And I think what we sometimes forget is if we've missed school, we're behind our peers. We may not have all the academic outcomes, the learning outcomes necessary to perform at grade level. And that is not a comfortable place. So sometimes we have to address those academic deficits in addition to the things that we're addressing directly at the anxiety. And quite frankly, that's not something we as an education community have been real good at. Identifying past academic deficits, doing real good clinical diagnostics of those, and then addressing it. You know, if we can engineer success or accomplishment in school, a lot of times it's more rewarding intrinsically.
You know, one last thing I'll add to that too, Mark, you know, you bring up a great point is sometimes our students come with their cell phones, and that's a very anxiety producing tool. And the healthier our kids are getting, sometimes I'll have students, we have a no cell phone policy in the district, right? But there are still some students that will actually bring me their cell phones in the morning, turn them over to me. I'm not asking for them. It's not part of a policy. It's their choice. And I put it in my credenza because just having it on them creates anxiety, that fear of lots of different fears that we're all aware of. So it's not always just giving them more things. I think sometimes it is getting them into the classrooms because that's where those connections are happening with their peers. The more that they're out of the class, the more they're missing that peer connection. And that's harder to jump back in. I think sometimes too, we have to take a look, and, you know, we talked about bullying as one of the reasons. And that is something that we definitely take very seriously in Forest Hills, incredibly seriously. But sometimes too, we do things outside of school that cause us shame or embarrassment that can keep us from wanting to come back into school because our peers know what we've posted and now we have regrets for posting. So the more that we can do a deeper dive to help our students really understand the dynamics so that we can really scaffold them up, I think is an important piece.
Thanks, Becky. You actually answered the next one in your wrap up. All right, Christy, this one's for you. My daughter struggles with connections with her peers, and that makes school less appealing to her. Are there student groups or ways to connect her with others to help with this?
Absolutely. And like Becky just said, if a child feels like they are safe and part of a greater community and that they're valued as part of that community, they're an integral part of that community, they are going to want to participate. And so that's our goal oftentimes is just how can we make connections with kids? So we're out there greeting them at the door. Hey, we're so glad you're at school today. We're saying that throughout the day, you know, asking about their personal lives, taking an interest in them personally. So they feel like somebody cares about me. Somebody cares about what I care about, what I'm into, what I'm passionate about. And so we, as a school, we're doing that. If the child is struggling with social connections, we can do it formally. We do things like friendship groups, social skills groups. We ask our teachers to refer students to us that they notice this child is not having anyone to play with on the playground, or they're sitting on the buddy bench and they're wanting someone to play with. We want them to get connected. And so we will do friendship groups to probably help those kids that are maybe shy to get those advocacy skills and how do I strike up a conversation with another student. Teach them those kinds of skills to initiate relationships with other students. If they're a student that has other social needs, maybe they're not understanding social norms, social cues, and so that's off-putting to their peers. We also work with those students and how can we form lasting relationships, not just initiate and form, but maintain a friendship. What is a friend? We educate a lot on the what is qualities of a friend. What do I look for in a friend? So some of that is more formalized, and then informalized. Like if we know a student's really struggling, we'll do things like hey, who are some kids in your age group that are your class or other fourth grade classes that you want to get to know better? Let's identify some of those people. Who do you have common interests with? We have to educate kids about what is a good friend. Well, it's someone who I have in common interest with. Who do you have common interest with? So we're helping them narrow that down. And then maybe we invite them to bring a friend down for lunch in an informal setting. Why don't you come down at lunch, bring this person, we'll play a game together, because sometimes they just need to jumpstart those relationships. And once they do that and form those connections, they're self-sustaining, but we need to help them get to that point. So sometimes just getting them to make those connections. Other things that we can do is just help those students to get some community connections, maybe into a school-sponsored extracurricular activity. Maybe they have an interest in running. We talk about Girls on the Run as an option for them, or Girls and Boy Scouts, or Odyssey of the Mind if they're creative and into STEM activities. So what are they into? What are they passionate about? How can we connect them with other peers who have those interests in a social setting where they're building those social skills, they're practicing them in a session or in a safe setting where they can generalize them to other situations. So really, if you're worried about your child making those connections at the elementary level, maybe reach out to your classroom teacher first, and they have a good understanding of who they're connecting with or not connecting with, or the counselor, and we can work together to help them build those connections, or give you as parents ideas and how to do that too.
Becky, at the middle level, would that look very similarly?
It would, but more informally. Many of our middle schoolers don't want forced friendships, but we take, like what Christy said, we take that lead and maybe do more informal things like, hey, I'm doing a thoughts and trends group, and I've grabbed these 5 people that happen to have the same similar interests that I think would make really good friendship connections. And then maybe we'll have a conversation about how we can make our school better. And then through those types of meetings, it's not a friendship group, it's how do we make our school better. They make those connections and build those relationships. And then we have them sit with lunch, and then we slowly do an approximation again to build those connections, or outside activities, ski club, science Olympiad, any activity where there is groups. We have conversations too with our teachers and say, hey, Becky really is struggling with making a connection, but she really likes Sally. Is there a way that you can get Sally and Becky together in a group, and then maybe bring Dan in the group as well? So we do more informal behind the scenes things to build those connections.
Okay, we have one last question that I'm going to let you guys respond to. And then if you have any last thoughts that you'd like to share, panelists, then you will have that opportunity before Tamara wraps us up. So this question, and I think it is honestly a really good question, and it's one that I think we get often, is, as my child transitions from one building to the next, what should I preemptively share with staff? How should I make sure that they know maybe my child has struggled with things in the past to set them up for success going into that next transitional phase?
We love talking with parents. We love phone calls and emails and face-to-face to say, tell me about your child. We want to take that time so that we can build that connection and trust. Bring your child as well so that we can show them the building, show them when it's quiet. August is a great time for that, or maybe even the end of June before summer starts, so that there's a touch point and they don't have to worry about it all summer long. Reach out to us. We want to know.
I would echo that too. And, if there's a specific instance that you want us to be aware of, like, for example, I am working with a child right now in a 3rd grade setting. She has a trauma background, and her teacher seems to have a loud booming voice, and it's a trigger for her. Well, without knowing those kinds of things, it's hard for us to know placements for students. So if the more information that you're comfortable sharing, the better. Is helping us know where to place students, where they're going to be planted and being able to be grow and most successful. So when we have articulation meetings I will meet with the counselors at the 5-6 level. Becky will meet with the counselors at the high school level, and we'll have those conversations about where would this child be most successful, what teachers should we place them with, what students should we place them with. So any communication, like Becky said, is so helpful for us to know, because the more we have, we can make those informed decisions. So please just continue communicating with us.
Any other lasting thoughts before we have Tamara wrap us up? Anybody on the panel?
I want to say one thing, and we as counselors fully understand how hard it is to parent. It's hard. It's painful, it's scary, a fear can creep in. Just please know that when we have the privilege of working with your kids and with your families, that we lead with a positive assumption. We don't have a sense of wanting to place blame or point fingers. Yeah, we know and we get it. Many of us are parents, grandparents, and it's tricky. But together, I think if we keep working together, there's hope, authentic hope, and we will never give up on your kids.
All right, Tam, go ahead and wrap us up for the evening. I just want to thank everybody on the panel and truly in the audience. Thank you for joining us and being a part of our first series.
Thanks, Christine. And thank you to our Forest Hills community. Again, thank you to the panelists. We so appreciate your time and your expertise in bringing this valuable information to Forest Hills and to our families. I want to thank Christine especially for coordinating this effort and providing all the logistics, getting us together to do this. So thank you, Christine. Also, I would like to shout out to the other AAA steering committee members, which are Heather Lund, Ann Scholler, and Michelle Cox. If you are interested in joining AAA, it is a parent-led volunteer group. Please connect with us on our Facebook page, which is FHPS AAA on Facebook. If you have questions, if there's something you think you might like to see in a future presentation, let us know that on that Facebook page, but connect with us there, please. I'd also like to gratefully acknowledge the support of Forest Hills Public Schools Foundation. They have funded this effort in this presentation tonight and the entire series that we'll be bringing you this season. And that leads me to our next thing, which will be on February 7th. We have another event. It will be in a virtual format as well. February 7th, and that will be on safe relationships and environments. So if you have students who are getting to that dating age, what does a healthy relationship look like? In addition to that, we'll have someone from Safe Haven Ministries and someone from the Kent County Human Trafficking Coalition who will be speaking on some trends that they're seeing, just so that you can keep your kids safe. So again, please be on the lookout for that. That will be coming out through Eventbrite again, and we hope that you register. Until we see you again, please stay well, stay safe, and thanks for being here. Have a good evening. Bye-bye.